This is one of my favorite times of the month because I am a flaming extrovert. And so I just love getting to meet with other public health people and talking about things like my soapbox on public health funding and how we deal with that. I normally wouldn't give an introduction about my background because it's not super important. But for today, because we're talking about how I explain to other people what I do, it actually is pretty important. So I'm the CEO of Flourish and Thrive Labs, but before this, I was the Chief Information Officer and Chief Data Officer of the Lake County Health Department in Illinois, and I was there for 5 years. My academic training is as a health informaticist. So I sort of bridge the gap between technology and public health practice. So I have training in public health practice, and my sort of areas of focus are maternal child health and injury epidemiology, which is a very unique space of epi to think about. And then the technology side, and then I'm a technologist, so I have a background in geospatial technologies and data science and machine learning. And so my job is usually to bridge the two of those things as an informaticist. So that is a really hard thing to explain to people who have absolutely no idea, first off, what even public health is, and then start talking about being a public health informaticist, and it's all of a sudden like eyes glaze over and I'm done, right? And so I sometimes have this experience of like bringing people to, right? It's like show and tell of your work. And so this is one of my favorite clips that I have been waiting for a time to show this. And so I wonder if you all have had some of this type of experience when trying to explain what you do to either your kids or your friends or something like that.
This is my file cabinet. Oh, this is the partition between my desk and Angela's.
If you have not had that experience yet, I hope that someday you will, because it is a very humbling experience to be like, oh wait, I have a small human that needs to know that I'm trying to explain what I do, and how do I do that? And when it comes to public health, this is what I think about, right? And I'm sure you've seen these memes before of like, what is public, like what is whatever. And it's like what my parents think I do. Barack Obama is what my friends think I do, what my kids think I do. Thanks to Hollywood, society has a very specific view of what public health is, what I thought I would be doing versus what I'm actually doing, right? And so when we think about how do we explain public health and what we do to different people, we're really trying to correct this image, right? And it can be really hard. So there are 3 people in my life that I wanted to talk through how I explain public health to them. And hopefully this will be a little bit of help if you've never thought about how to explain this to these different types of people. But also I'm looking forward to hearing how you all explain it when we get into the breakout room. So the 3 people in my life that we're going to talk about are my friend Beth Ann, my mom, her name is Jill, and then my daughter, Junia, who is 19 months. So how do I explain public health to those 3 different people? So with my friend Beth Ann, it's really a show and tell, right? So we had a bring your friend to work day, essentially, where we sat and we talked about what our work was. And, she's a PhD historian. And so we got to hear about what her work was. And she got to hear about what our work is. And it was really interesting because we were able to find these places of commonality between, what she's doing, and she's doing a lot of like survey work. And then what public health is about understanding your community and trying to make positive change in your community. And so I recommend Bring Your Friend to Work Day. If you have a friend who wants to know about public health, I think that it's a great way to really help them to understand it. So then with my mom, I actually use an allegory that was published in like 2009. And you guys have probably used this potentially before. You've probably used this imagery, or if you haven't, I hope that this is helpful for you. So it's this idea that like, as a society, we build our community on this cliff, right? We build it on this really high cliff so that we have this amazing view. And what happens is at some point, somebody falls off that cliff, right? And that's the health event. And at the bottom of that cliff, we have an ambulance waiting for you. And that, you know, any of us that fell off that cliff, we would be very thankful for that ambulance to take us to a hospital so that we don't have long-lasting repercussions of our fall off of this cliff. Now, we could ask the question of why in the world we built a community on a cliff, but we did, right? We built the community on a cliff. So I take my mom through this and I talk to her about like, this is what it looks like without public health. Now, what public health does is we say, okay, we built a community on a cliff. I don't want anybody to fall. The goal is that nobody needs that ambulance. So what do? So I put a trampoline halfway down on that cliff so that maybe when somebody falls off of it, they hit that little trampoline and they bounce a little bit and they have a good experience and then they don't need the ambulance. Or maybe I put a fence at the top of the cliff to warn people and to keep people back from the cliff, right? Now, not everybody is going to follow the fence. People are going to climb over the fence. Not everybody is going to bounce on the trampoline. They might bounce and then bounce off, right? So people are still going to need that ambulance. But as public health practitioners, this is what I do, is I work to figure out, where do I put that trampoline? How big does that trampoline need to be? How bouncy does it need to be? How high does the fence need to be? Where does the fence need to go? All of those things. So I try to protect this community that built the thing on a cliff to not need that ambulance anymore. So that's my mom. So now let's talk about my daughter. So 19-month-old Junia, she understands way more than I think she does. But at the end of the day, right, she is really living in her lived reality. So I have to talk about public health in things that she has lived through, experiences that she has had. So when we go and get her vaccines, we talk about that this is public health. This is helping keep her healthy, but it's also her helping keep her community healthy. Whenever we wash our hands, we talk about that this is what Papa does. He thinks about how many people need to wash their hands in order to prevent some disease from happening. And then we have a greyhound at home. That's a picture of Junia and our greyhound Teddy at the top there, having a stare off when she really was not very mobile. And, you know, we talk every time that we give Teddy his monthly heartworm medication. We talk about that we're helping to protect Teddy, but we're also helping to protect her and Mama and Papa and all the people around us, because some diseases that dogs can get, we can get. And we don't want to spread it across to the rest of our community. And we want to be good. We want to be good community members. So that's how I explain it to Junia. I take things that she is living, her lived reality, and we identify which things are public health. And really, when you think about it, there's a ton of them, right? Like public health really touches everything. And so as you talk to your kids, we have to recognize that it's like things that they enjoy, things that are familiar, things that are lived experiences, and we can tie those into public health to really have that experience. So that is how I explain public health to 3 different groups of people in my life.